You'll need to click to continue. Thank you all for joining us today. I'm Judy Gooding. I'm a senior advisor here at NICHQ, and I'll be helping to lead today's webinar. We're going to get started in just a few minutes. And before that, would really appreciate you using the QR code here to take a pre-webinar survey. Just takes a moment. Hi, thank you for joining us. I'm Judy Gooding, and I'm a senior advisor here at NICHQ. We're going to get started in a few minutes, and until then, if you could take that pre-webinar survey using the QR code on your screen, that would be great. Thank you. Hi, as we wait for the beginning of the webinar, please take a moment to use the QR code to take our pre-webinar survey. Thank you. While we're waiting to start our webinar in just a few minutes, would you take a moment to use the QR code to take a pre-webinar survey that you see there? That would be great. It really helps us to improve our webinars. As we wait just a few minutes for others to join, we'll be starting our webinar in just a moment. And until then, if you could take the pre-webinar survey using the QR code that you see on your screen there. Thank you. This helps NICHQ, ever an improvement organization, to improve the quality of our webinars and our information dissemination. We appreciate your help. Okay, let's give everybody one more chance to get that pre-webinar survey into it started using that QR code. You see it up on this screen as well. If you can take a moment to do that while we're introducing the webinar, I would really appreciate it. Thanks so much. I'm Judy Gooding, and I'm the project director for this initiative. It's called Disseminating Results, Missed Sickle Cell Disease Clinic Appointments and the Health Belief Model. This project and today's webinar are funded through a Eugene Washington Engagement Award from the Patient-Centered Outcomes Research Institute. That's PCORI. Our session today is the second in a series of 3 webinars and other activities to disseminate information to patients, families, caregivers, providers, and community-based organizations to support families and patients in attending sickle cell disease appointments. I'm pleased to welcome our program officer from PCORI, Courtney Clyett, who is among our participants today. In addition to the important support and funding from PCORI, I want to thank you, Courtney, for the perspective and engagement you bring to our work. While you won't be sharing your camera or your audio this afternoon, we really want to hear your voices. We invite you to chat questions into the Q&A box and comments into the chat box throughout the webinar. To access that, you click on the chat box image on the toolbar at the bottom of your screen. Please make sure to chat to everyone. And when chatting, please share your name, where you're from, and whether you identify as a patient, a provider, an advocate, or the caregiver of a patient. Thanks. We really look forward to hearing what you have to say. Now first, who's NICHQ? We're a mission-driven nonprofit that for 20 years has focused solely on driving dramatic changes in the complex issues facing children's health. We've led nearly 100 initiatives with a focus on executing and scaling systems change to improve children's health and increase equity. We have a concerted effort around improving sickle cell disease care and have spent nearly a decade working on national programs to help people live healthy and fulfilling lives. Currently, we're the National Coordinating Center for a regional collaboratives program across the U.S., funded by the Health Resources and Services Administration. And I want to welcome those of you who are joining from that national program. At the heart of what motivates us at NICHQ is the belief that children and families deserve better systems and supports so that every child achieves their optimum health. Now, we're going to start with a poll here just to see what you're thinking about this subject at the start of this webinar. And so everybody, I might need some help in instructing folks on how to use the poll. But you should be able to use your cell phone, text NICHQC 876 to the number 22333. And once you join to do that one time to join, and then text your message. Text your answer, one word to this question. When you think about missed appointments for your patients, what's one word that comes to mind? I know. Obstacle. Stress. When you think about missed appointments for your patients, what's one word that comes to mind? Use those phones. Opportunity. We have another barriers in the chat box. So we'll make that a little bit bigger. Okay, we're gonna close this out. We'll see, maybe people can let us know in the, it's a good word. Like several people are using it. Confusion from Poppy in the chat box. We're going to move on. So we have confusion and barriers and hurdles, opportunities someone put in. So next, I want to introduce our panelists today. We have 4 panelists joining us for this conversation, and I'd like to introduce them now. There is Dr. Suzette Oyeku. She is chief of the Division of Academic General Pediatrics at Children's Hospital at Montefiore. She's also professor of pediatrics at the Albert Einstein College of Medicine and a practicing pediatrician, including caring for children and youth with sickle cell disease. Dr. Oyeku serves as medical director for the Sickle Cell Disease National Coordinating Center that I mentioned a moment ago. Ms. Talana Hughes is the executive director of the Sickle Cell Disease Association of Illinois, where she provides overall leadership and organizational direction. She's worked tirelessly at SCDA of Illinois for the past 16 years, managing the HRSA federally funded newborn screening program. Ms. Hughes is a fierce advocate for improved healthcare and patient services for patients with sickle cell disease. She has an 18-year-old daughter with sickle cell disease, as well as a daughter and son who have sickle cell trait. Ms. Hughes and Dr. Oyeku serve as faculty for this PCORI-funded sickle cell disease project. Dr. Carolyn Rowley is a clinical psychologist and a nutritionist and is founder and executive director of the Cayenne Wellness Center in Burbank, California, which provides education, advocacy, and support for people living with sickle cell disease. Discovering a passion for Kenya's children, Dr. Rowley founded the Machao Orphanage Foundation and has plans to form a collaborative with the US and Kenya to create a surveillance program, newborn screening, access to treatment, and best practices for the management and treatment of sickle cell disease. In 2007, Dr. Rowley was named Person of the Year by the National Institute of Health and Sickle Cell Disease Association of America at their 35th annual convention. Dr. Jimmy McGilligan, is executive medical director for the Medical University of South Carolina Center for Telehealth. And as a practicing pediatrician, he led the formation of the South Carolina Telehealth Alliance, which he currently chairs. Dr. McGilligan is committed to his work with children and youth with special health care needs, including serving children and young adults with sickle cell disease. His passion for children's health and telehealth led him to launch the first school-based telehealth program in South Carolina and to assist with authoring the South Carolina Telemedicine Act. We'll be hearing from Drs. Rowley and McGilligan a little later in our conversations. And we'll start with what we're here today to address a critical concern for patients and families with sickle cell disease. In 2018, the Mid-South Clinical Data Research Network published a multi-year national study that showed that most adults and caregivers of children reported having had to miss a clinic appointment. This means that a majority of people living with sickle cell disease may miss out on therapies that have the potential to improve their health outcomes. And that's what we're really working on today with all of you. I'd like to welcome any of the authors who may be on the webinar today and thank them for letting us disseminate the results of their research. During the rest of this hour, we'll address the following objectives: identify 3 of the common reasons for missed appointments, learn 3 conversation strategies to improve, and identify 1 immediate and 1 longer-term action to take. Our primary goal was to really find ways for providers and patients to work together to make it easier for patients and families to attend appointments. We're going to start with some introductory information from our faculty experts, and we'll move into conversation strategies and modeling, giving you a chance to dissect and discuss. After that, our panel will hear your experiences, your challenges, and your solutions, and all of them will join in considering the issues that you bring to the chat. Let's begin with Dr. Oyeku and Ms. Hughes. Dr. Oyeku?
Thank you so much, Ms. Gooding. So thank you, everyone, and thank you for this afternoon joining us. So I wanted to first start where we are all on the same page in terms of thinking about sickle cell disease. I anticipate many of you know about sickle cell disease, but I just want to level set for those that may not know what sickle cell disease is. It's an inherited blood cell disorder that inhibits or blocks the blood flow, and that deprives our tissues of oxygen, and that can lead to very painful episodes, stroke, and end organ damage. If you can see in the cartoon on the right-hand side of your screen, you see soft donut-shaped red blood cells traversing the vasculature freely. And then on the bottom part of the cartoon, you see the abnormally shaped sickle cells, which end up getting blocked in the vasculature. And that blockage is what essentially blocks blood flow and ultimately oxygen to those organs. It's the most common genetic condition in the US, and it affects approximately 100,000 Americans. And globally, it impacts millions worldwide. It can occur in any racial group, but it disproportionately impacts individuals who are African American, Latino, Latinx, and Middle Eastern descent. We know that timely coordinated care is vital for the improved outcomes, and that's why this topic today about missed appointments is so relevant, because if there is not timely care, you can sometimes miss some of the complications related to sickle cell disease. Next slide. We would be remiss in terms of doing this session without talking about the impact of the COVID-19 pandemic. Over these last almost 18 months, we've all been grappling with this pandemic. And we know that adults have been more disproportionately impacted by COVID-19. We know that children are less likely to be affected. Currently, the proportion right now has actually increased from 11% to 14% of cases in the US are among children. And I think we're seeing that more just as people are starting to go outside a bit more. But we see that our younger kids tend to be less likely to be affected. The bulk of the cases are between 5 to 17 years of age. And children tend to have less severe complications. The majority of kids either have no symptoms or they may have mild symptoms, so mild fever, cough, runny nose. But we do know that there is a subset of children who have more severe complications and may be hospitalized. So about 7% of children with COVID-19 have been hospitalized, but a very small proportion, less than 1%, have died from the infection. We know that our families, specifically, even though children may not be a significant burden of COVID-19, they live in families. So if they get exposed, they get sick, they're in this context. And we know children tend to be more vulnerable. So 1 in 5 children live in poverty. We'll talk a little bit more about the impact of that, particularly now in the pandemic. 31% live in a single parent household, and disproportionately those are individuals of color. And we've noticed over this past year, a rise in terms of distance learning. Many parents, I know many of my parents here are excited about their children potentially going back to school face to face. Next slide. So what has been the impact of the pandemic on children? One, I think, is, as I said, kids are part of families, and there's been a disproportionate loss of income. The unemployment rate has increased. There's been an increase in housing insecurity, food insecurity, and that all impacts a child's overall health as well as well-being. We also know that the social distancing policies definitely have played a role. So depending on people's households, they may not be able to socially distance. They may not be able to access certain resources and services. We also know that because of the pandemic, we've noticed particularly our children with special healthcare needs, which represent about 18% of children across the US, they've had a disruption in their services. So many of them that get therapies, occupational therapy, physical therapy, speech therapy in their homes or in schools, those have been disrupted. So we know that we have a generation of children whose overall health and well-being has been disproportionately impacted because of the pandemic. And I think, time is only going to tell really the impact on our children and their overall health. Next slide. So one of the things as a pediatrician, we all were watching this very closely in terms of the what were the health risks related to the disruptions in both health and social services. And one of the things that we saw last year was a significant decline in vaccination. So when you look at on the dark blue bar is January 2020 compared to May 2020, you saw that there was a 34% decline in childhood vaccinations. We also saw declines in screening, as well as dental services, and then outpatient mental health services. I'm glad to say that we've noticed increases in these rates, but they're not back to 2019 or 2020 levels. And so there's still children who need these services, and that we need to connect them back into care. And that's why this session is helpful for us to think about how do we address some of the barriers to families making their appointments. Next slide. I'd also be remiss in terms of not talking about the COVID vaccination. So I think even though we see close to 154 million individuals being vaccinated, fully vaccinated in the US, we definitely see that the disparity still exists. So on the right-hand side of the slide is the proportion or percent of persons with at least one dose of the vaccine and broken down by racial ethnic categories, and then the percentage of the US population. And what we've done is circled and highlighted for you that there's still a gap between for Hispanics and Black Americans. So Hispanics represent 17% of the US population, but only 15% of individuals who've gotten the first dose of the vaccine. Black Americans represent 12% of the population, but they represent only 9.2% of individuals who've gotten the first dose of the vaccine. Why am I bringing this up in the context of a presentation about sickle cell disease and missed appointments is that we know that individuals with sickle cell disease are disproportionately at risk in terms of having COVID infections. And so that's why it's important for us to just also advocate, in addition for people keeping their appointments, is also to get their information and then get vaccinated. Next slide. So one of the things that we saw in terms of, as Judy alluded to at the beginning of the session, was the paper that our colleagues had published. But we did also some focus groups and to look at what were the top reasons for missed appointments. And, as most people know, in the blue, dark blue is adults, and in the tealish color is caregivers or children. And the majority of the reasons is that people forgot. Which is common. And then I think particularly given all the competing priorities in this last year, we've all noticed that. But the other reasons in terms of time did not work. They didn't have transportation to get to the appointment. Their own personal health impacted that. We noticed that a lot last year where people had family members who were sick, so they couldn't leave the house, or they didn't know about the appointment. And I think, what all of this underscores is really the importance of the provider and patient and family relationship, because if they have that communication, then some of that dialogue about what may be transpiring in the home, the providers may be able to assist and the team may be able to assist families to overcome those barriers. Next slide. We know that COVID created some new barriers, but then also led to some interesting innovations in care. So I think, many of us had a decline in in-person visits because many people are afraid to leave their house. I had patients who, did not want to leave their house because they were concerned about potentially catching COVID. I think over the last couple of months, in terms of coaching people to leave and what they were going to experience, that has increased. But to be able to counteract that is that many institutions have all introduced e-visits or televisits and remote care as a corollary to care during the pandemic. And I think for many people who live in rural settings or far distances from healthcare institutions, this has been a major boon because now transportation is not a factor anymore and they're able to connect with their healthcare team. There's still, you know, a bit of the digital divide for some of our families, but it still provides an opportunity to connect people to care. But I know for many patients, they still are weighing whether or not to manage a crisis at home or go into the hospital. I had a patient 2 weeks ago who said to me, Dr. Oh, I do not want to go to the ER. So I kind of wait until the day hospital is open so that I can go to the day hospital during the day. And so I think for many people, this is still a lived experience because there's still variants out there and there's still cases of COVID-19. So I think our patients and families are trying to be prudent in that regard. Next slide. So one of the things I alluded to is just the context in which we think about missed appointments and kind of the rationale behind missed appointments. So one of the things that we think about, this framework is called social determinants of health. And that is really the conditions in which, and the environment in which people are born, live, learn, work, play, and worship, and how these might all impact health outcomes. And we know that if you go around this circle, so health and health care is only a small proportion of people's health outcomes. A lot of health outcomes are due to their environment, their economic stability. So if they are living in poverty, if they have food, if they have stable housing, if they have energy, the education and their literacy level, and then also, you know, schooling and the school context. All of these factors play a role into people's both health and mental health outcomes. And so we're going to talk through this framework and understand some of the reasons behind the missed appointments in the upcoming slides. So I'm going to turn it over to Ms. Hughes.
All right. Thank you, Dr. Oyeko. In NICHQ's interviews with patients, caregivers, and providers, we learned about common barriers and opportunities for improvement. We shared those findings in our first webinar, which seemed so long ago, back in August of 2020. And today we are building on what we learned from patients and families to activate some of the solutions. Transportation, of course, emerged as a common barrier, both from the research study and the interviews conducted. In NICHQ's key informant interviews with caregivers, patients, and both pediatric and adult providers, transportation was highlighted as the biggest obstacle to attending appointments. Another barrier shared in our interviews was related to health literacy. Building health literacy and understanding about sickle cell disease and the importance of monitoring the disease and treatment was noted by all of the respondents as a motivator for appointment attendance. Also noted by both patients and providers, not understanding the importance of monitoring disease modifying medications, such as hydroxyurea, may also lead to poor health or pain crisis episode. Scheduling changes was another major challenge cited in interviews, and we have grouped that with forgetting the biggest reason for missed appointments in the study. You can see the issues, work and school conflicts, multiple appointments, childcare for other children, and importantly, the hectic life of a family living with sickle cell disease. Actually, for many families who among us have not missed an important appointment in the last year. Next slide. So we have a poll question. It should have popped up for everybody. How many times in the past year have you missed an important appointment? Not just healthcare, and just because things got hectic and you may have forgotten. So take a moment and answer. And then also after you answer, feel free to chat in what happened. So if you missed one appointment or forgot about one appointment, feel free to let us know why. You don't have to, but it would be nice to kind of share. And then how did you deal with it and what were the consequences of missing or forgetting that appointment? Don't be shy. Okay, so here are some of the results that we got back. 24% didn't miss any appointments. 52% missed one or forgot about one, 16% forgot about two, and then 8% forgot about three or more.
Well, I just want to comment, this is Judy Gooding, and I just want to comment that that's a number that's fairly close to the numbers found in the study for sickle cell disease patients in the last year. We weren't counting, that was one or more at what, 87, 83. So.
And I see we have some comments popping up in the chat. Doctor would not refill medicine until I came in for an appointment. Forgot to write it down and rescheduled. Things got out of control at work, so I missed the dental appointment. Missed due to competing demands, had to reschedule, but felt incredibly bad about missing an appointment. And then just missed an appointment due to scheduling conflicts, which all happens and makes sense. All right. Thank you all for participating in that poll. Next slide. So our interviews also surfaced strategies to increase appointment attendance. Here are the ones we're going to discuss today, from straightforward solutions like simple appointment reminders, solutions that are relationship oriented, like involving your local community-based organizations and possibly community health workers or patient navigators, and also improving the relationship between the provider and the patient. Next slide. While the patient and provider relationship itself may not be a barrier to attending appointments, improving the relationship is important to every solution. Both patient and providers agree that the strength of the relationship based on mutual respect and trust affects routine appointment attendance. And thus the importance of the patient-provider relationship should not be underestimated. Relationship struggles and missed appointments increase when a caregiver or a patient does not feel as though their experience has been respected. Patients and caregivers have reported that they feel that providers have, and sometimes wield, power in a relationship that can result in humiliation or embarrassment. Feelings of both embarrassment or guilt for missing the appointment can keep patients and caregivers from communicating with providers about conflicts and challenges from making or attending future appointments. Provider recognition and understanding of the reason for missed appointments was also noted as important for treating a patient with respect, alleviating embarrassment or guilt, and building a trusting relationship. And now I will turn it back over to Dr. Owieku.
Thank you so much, Ms. Hughes. I mean, and you raised such important points about the importance of the patient and provider relationship. And I think, one of the things that we, want to remind folks is just our caregivers and patients interviewed, they agreed that providers do play a key role in ensuring appointment attendance. And I think some of the things that they have, shared in terms of highlighting for us is to be aware of our implicit biases. And so implicit biases are these thoughts that we may have, these attitudes or stereotypes that affect our understanding and actions and decisions in an unconscious manner. They typically are split-second kind of assessments that we make, but these we know can impact decision-making in the clinical context. It's also important for us to be respectful of our patients' experiences and the challenges that they face. So understanding the lived experience that our families face. I practice at a teaching hospital, and I frequently tell our trainees that, it's important for us, if a parent comes in late, for us to understand where they were coming from, because you never know that somebody took 2 buses and a train to get to the appointment. So just understanding people's lived experience before, making any assessments. Also being authentic, I think that goes a long way. So showing a genuine interest in how our patients manage care, but also their life outside the office. It's always interesting and fun when I bump into family members in the grocery store, because for the kids, they're like, oh, Dr. O is a real person. But it's important to still, be interested in terms of their lived experience outside the hospital. And then building trust. That's important in terms of building, that's the bedrock in terms of building a strong therapeutic relationship. Your patients are more apt to listen to you if they trust you. And so that's important for us in terms of thinking about these considerations. So I'm going to turn it back over to the team where we're going to talk about creating solutions through the conversation.
Wonderful. Thank you very much, Ms. Hughes and Dr. Oyeku, for all of that background. I think it was very important to hear that as we set the stage for the conversation. So now let's dig into really talking about this and how these conversations can go, because we realize it's all a lot easier to describe than it is to actually do. So we want to share ideas and hear your ideas that can help us all have conversations about appointments with patients and with their caregivers. I also want to take a moment to recognize that we may have some patients and caregivers in our audience, and I want you to think about and contribute, please, to these conversations, to the chats from your perspective, because everybody's perspective really matters here. Now you're going to hear a conversation between a caregiver and a provider, a caregiver named Deborah and a provider named Dr. Taylor. It's going to be by two of our panelists, Dr. Rowley and Dr. McGilligan, both providers and advocates in their real life. They're playing these parts. And this is a story that takes place in a pediatric hematologist's office. William, who's 8 years old, has missed 2 appointments in the past year, and one of them was his annual stroke screening, his TCD screening. And Dr. Taylor's worried, and Deborah, William's aunt, shares caregiving with his mother. So as you listen to this role play, consider whether any parts of the conversation sound familiar to you, and imagine what you'd do in this situation. If you were Dr. Taylor or Deborah or a bystander, how would you feel and what would you say? Feel free to chat in if you hear something going awry that you want to comment on, and if you see that see parts of the conversation on track. We want your perspectives on all of this. And then shortly after this, we're going to ask you to present us with some scenarios for our panelists to all talk about. So I'd like to invite Dr. McGilligan and Dr. Thank you. I see you nodding, and Dr. Rowley to play their parts.
Okay, hold on. Okay, I'm ready. I'm glad you could stay a few minutes longer to talk before William's appointments. I have to squeeze this in quickly because, you know, it's not like Medicaid covers talking about this.
Okay. What is it that we're talking about?
The front desk didn't tell you. Well, William has missed 2 appointments already this year, and it's only July. I want to see why so we can fix this problem.
Okay, goodness. So which appointments exactly? You know, I've been juggling a lot since I took on getting William to all of his appointments, and I'm trying to catch up on them. So which appointments did he actually miss?
Well, he's only had 5 appointments in the past 6 months. It seems like not that much to keep up with. I mean, other families have even more. The first one was back in February. It says here that he was a no-show. We have a policy that if you have too many no-shows, then we can't keep seeing him.
Okay, look, I'm doing the best I can here, okay? It's not all my fault, but you're just putting all this problem on me.
I'm sorry. Maybe I was just rushing. But it is your responsibility to make the appointments, and I don't want to lose William as a patient. He's a great kid.
Yes, he is. So, well, no show can't be right. I just started helping my sister with this in January because she was getting too sick to be able to bring him all this time. So in February, hold on, let me get my phone. I'm gonna look at my calendar. Oh yeah, okay. So that one I missed because I never got the calendar alerts from the clinic. His mother was getting them, but it was supposed to be changed to me. So we missed it. But I don't think it's fair to say that he didn't show up when I didn't even get the notice.
You're right. It's not fair. I'll talk to our records person about that. It sounds like you're having a tough time and taking on a lot. After we talk here, I'm going to ask our scheduler to go through the calendar with you and set up our appointment alerts. It looks like you use your phone calendar to keep track of this, right?
Yeah, like most of us, these appointments and everything else. So look, I have his mom's appointments, my work schedule, Williams after school program, and my own kids. Getting notices and alerts would really help me a lot. Wait. You said there were 2 times we missed.
Well, the other one was last month. He missed his TCD test, and it looks like that was rescheduled for next week. Was that a scheduling problem too?
I'm sorry, TDC, TCD, what? I don't even know what that is. Let me see. Hold
Well,
on,
that's
please. Hold on.
okay. That one's his stroke screening.
Okay.
He's supposed to get it every year. It's one we really don't want him to miss.
Okay. Okay. Oh, the screening. But he didn't miss that appointment. That's why I said, hold on, let me look at it. He didn't miss that appointment. We came, but then there was some problem with his insurance. He's on Medicaid, and I'm still learning about this. A clinic person helped me get it going again, and they told me to come back in July next month. Yeah. It was a real pain because I took the whole day off work, and William took out of school for nothing.
I'm looking through the chart here to see what happened. I see. Right, his Medicaid lapsed, so they had to reschedule. I'm glad they helped get this one back on.
Okay, me too. You know what, doctor? I know all his appointments are important, but the person didn't tell me this one was the special one. I thought it was just a yearly routine thing. You know, stroke is really scary.
I don't want you to be too worried. I know you really care about William. This is a very important test to be sure there aren't signs of hidden strokes, ones we can't see. Then we can take care to do everything we can to prevent them. That's why they rescheduled so quickly. At least it's in July and you don't have to worry about school conflicts.
Ugh, okay, July. I don't know what I'm going to do when school is out. William's mom is not doing well. Like I mentioned, she's really sick. And I'm going to have him with my family. And so my kids are going to a school camp program, but he's not in the district, so he can't participate in that. You know what? I'll have to figure this out. I don't really have any ideas. I'm not sure what to do.
Well, I've got 2 really good resources for you. It's our local community-based organizations. The first one is for William. The organization is called the Sickle Cell Disease Foundation of California. And they have a summer camp just for kids with sickle cell disease called Camp Crescent Moon. The second resource is for you and William's mom, and it's called Cayenne Wellness Center. They can assist you with resources like transportation, insurance, and other needs. They also have programs that you might want to join, education about living with sickle cell disease, support groups, and community health workers that can help you with things like Medicaid. And you get to meet families like yours. That can be really helpful, especially with this all being so new to you. Also, there's this video that I think will be helpful to you. It's about reasons people miss sickle cell disease appointments and some ideas of what to do about it. There's a QR code, you just scan it and you can watch it.
Okay, thank you. You know, seriously, that helps a lot. I'll definitely look into Cayenne Wellness Center and Camp Crescent Moon. I'll watch the video. Honestly, seriously, I've been feeling very overwhelmed with all of this. There's a lot for me to take on. Thanks for, talking to me about this. I learned a lot.
Well, I learned a lot too. When we talk at William's next appointment, I'll start with a much better idea of where you're coming from. You're doing a great job with William, and I'm sure your sister really appreciates it. Now, let me take you out to talk with our scheduler.
Okay, thanks.
I want to thank you very much, Dr. Rowley and Dr. McElligott, for playing those parts. I know you've both been in very similar situations, and for different reasons with different people, and certainly the role you played in your real life was likely quite different. And thank you for playing with us a little bit. I want to point out a couple of the comments that happened during the conversation. And first, let me say that whenever you're commenting in, it would be great if you'd make that comment to all panelists and participants, because then other people will comment on what you have to say and can be responsive, other than the folks, in addition to the folks on the panel. But some of the comments that came in talked about how totally realistic was one of my favorite ones. It was totally realistic conversation, and really felt like what normally takes place, what too often takes place. Um, there were notes about, why didn't the provider really, can the provider, or suggesting that the provider look at the chart first, and really understand at least the basics of why, what has happened in the past. And I think that too is a really good suggestion and a really common thing. Providers, like everybody else, are very busy and probably going a little bit quickly from one appointment to another, and so this certainly does certainly does happen. So thank you very much. And now it's time to hear from you all. What we'd like you to do is to put in the chat box to share your concerns and your scenarios and your questions and also your ideas. All four of our panelists will respond with their experiences, their advice, and their information. And just to kick us off, as you all are getting warmed up, because I'm sure you've got your own, your own examples. I want to throw this one out there, especially for those of you who may not work with sickle cell disease people who are living with sickle cell disease. But so this would be one from a person who says, I have this problem with appointments, even though I don't work with people with sickle cell disease. For me, though, it's about the kids. Sometimes their parents just can't get them to come in for the appointment. And then it's kind of a tussle between the parent or the caregiver and the child or the teenager. Talana, do you want to maybe, Ms. Hughes, do you want to maybe start with that one? Start us off with that one?
Okay. Can you say it one more time so I can make
Sorry.
Sure? Okay.
I'm sorry, and if someone else on the panel wants to jump in too, the question is whether you have a child or an adolescent with sickle cell disease or another special healthcare need, it can be hard to get, for the parent or the caregiver, to get the child in for the appointments. So many appointments, not all the appointments are, some of the appointments are frightening. And so this is a parent expressing frustration with talking their child into it, encouraging their child to get to the appointments.
So I would say first, even for the parent, but also for the child, is connecting with a support group. I think that support groups end up being very beneficial, and not even, for at least since the it's still a child, the parent, the more empowered the parent feels and supported the parent feels can sometimes result in a more empowered and more of an advocate, a child that becomes an advocate for themselves. Mm-hmm. But then I know that our parents that really participate a lot in the support groups, then a lot of times the children or our children also tend to connect with each other and have conversations with each other. And then also, as Dr. McElligott mentioned, summer camps are wonderful kind of confidence boosters and kind of show the children the importance of, having fun and challenging themselves, but then also taking care of themselves. But then they also get an opportunity to meet other youth with sickle cell disease, because I think a lot of times the kids don't always know somebody else that has sickle cell disease. So the more opportunities they can be put in front of peers with sickle cell disease or even adults with sickle cell disease, I think that is beneficial for them.
I'll just comment and say that, parenting is hard, and listening to parents is difficult. And sometimes you don't listen to the kid as well, and especially as they get older and they have a little more control. So I think it's the same theme, that doing some listening and engaging. I mean, when the younger they are, the parent, has to sort of drag them in, right? Eventually, unless you got telehealth, might be a good option. There might be other things to think about. But I think it all starts with listening and knowing your resources. Sounds like a great idea. But you have to be open to the idea that parenting is hard. You have to open to the idea that the view of the patient's parenting may be different than the provider's view too. And that's a big, difficult thing. And I think it all goes back to listening, which I did not do in that story.
What are some things that you would have done differently, Dr. Rowley or Dr. Oyeku, than from what Dr. McElligott did as in his, from what, excuse me, I'm so sorry, Dr. McElligott, from what Dr. Taylor did in that conversation?
Yeah. No, I mean, because I think he, pivoted quickly. I think he realized the conversation was not going well. And so, he was astute to kind of pick up on the energy and kind of pause and reset and get more information. So I think, probably the thing going into it was probably getting more information before and understanding, who the caregiver is, or just checking the chart, because you probably would have gotten some of the backstory about, the mom being sick and the burden in the family. And so could have started with a place of compassion and just like, how are you doing and how are things going? And starting from there. The snarky comment about Medicaid paying for talking time, probably wouldn't have done that. But, we all have our moments. But I think, but again, that's the authenticity part. So I think starting from a place of compassion and leading with the compassion and empathy, I think is, would open the door to people sharing. And, I've noticed that more and more over the years.
And I wanted to say, I like that because when a doctor talks about how much something is not, that something is not being paid, that's not my problem, because most of the caregivers or the parents had to take off work. And so they're not getting paid for actually having to be there. So yeah, talking about money um, or what's not being paid, or it's not, that's so inappropriate, I think, because of the different burdens that people have, whether it be transportation. People often talk about how much it costs just to park, so you have to park, you have to pay for that, you have to pay for the gas, and the fact that you have to take off work, or you're coming on your lunchtime, or what have you. So definitely for those listening in, that the not being covered by insurance is truly the wrong way to begin.
Okay, thank you. I appreciate that. And I do have one that I want to, that's come in from our participants. And that is this person really thought that the role play was spot on, and asks, how do you suggest handling habitual late or no-show appointments? It's hard to challenge the child, and I perhaps assume this is rightly or wrongly, that this is an adolescent, if the problem is really with the parents and their ability to make the appointment. So I'm going to start. I'm going to start with Dr. McGillicuddy on this one. Get him out of that Dr. Taylor role a little bit, because so we know it's not the real you.
Well, I don't know if that's fair. I mean, I've made these type of mistakes for sure, and I hope I make less of them. But I think, and I might kick this over to our chief of a general pediatrics division here in a second, but I will say I worry about this one a lot in my role. And at a health system, you don't always have control over your office policies and things like that. But I think, talk about implicit bias. Personally, sometimes I feel like it's built into the system, that there's an assumption that not making it to appointments is some behavior change you're trying to invoke upon a population in order to get them to make it to the next appointment, when really it's probably just a financial driver, and who knows if it's actually effective. So I don't like those policies at all. I mean, there should be other ways around them, where you sort of accept the patient. Maybe they have to wait till there's an opening and those kind of things. But it's hard to navigate that in the context of healthcare. So I think the first thing I would say is, you can't undermine your team, your front desk, your nurses, and all these other people. So you have to sort of work as a team, but, sort of understand, again, it gets back to listening what is actually happening, and understanding that every case is unique, and trying to not have those built-in biases. I mean, I do think if you're having a hard time with your patients getting to your office, You could blame the patients, or you could change your policies and your hours. You could use virtual care, these other things now that you could do. So I think that question really just hits right at the heart of many of the healthcare barrier problems.
I wanted to, I've heard one, this was at Stanford. I don't know if it was because of COVID or this is their actual practice. And I was always curious, why not have other hospitals who can actually utilize this. However, they don't have scheduled appointments. They have scheduled weeks. In other words, if it's time to come back, say in 4 weeks or 8 weeks, then they'll get a reminder to come in during that week, but not a set time, so that it allows for the parent or the caregiver to be able to change their own schedule to accommodate, but not be so tied down by that one small period of time during the week. Some things may come up, but if you know that during this week of June 28th, I have to actually come in, I think, and you can come in between 10 to 4, I think that you're more likely to be able to make an appointment, and it won't be missed, knowing that you have the entire week to pretty much schedule your time. I wonder if other hospitals are doing that, if that's something that can be done. I was always curious about that.
We're not, I mean, it's an excellent idea. We're not, I'm in New York, we're not doing that per se, but we are shifting to kind of open access. So really trying to take away some of the hindrances for families. So, trying to look at patterns in terms of when families want appointments. I'm in pediatrics, so definitely during the height of the pandemic, people didn't want to do the video visits during the day because the kids, they finally got the kid to be in front of the computer. So they're like, Dr. O, can we do this later in the day or earlier in the morning? So some of it was, just being open to that kind of flexibility. It is difficult as a provider because you may have other responsibilities. And so, having that flexibility also in your own schedule to be able to do that. So I don't know, how widespread it is, because it does require a level of flexibility of the entire care team, not just the providers. I work, in a unionized context, so you also have to make sure that your front desk and nursing staff and everyone else is available.
Thank you.
Yeah.
Sorry, thanks very much. And what I'd like to do, because we're getting a little closer to the end here of our time together, I'd like to ask all the panelists who have, participants and panelists who have suggestions or responses to this question from Dr. Rowley, to chat those in. And I'd like to go to one about that's kind of focused here on telehealth appointments. I think that might be what we. Oh, and in this case, a Google, sickle cell disease provider. But really focusing on a lot of people now have, want to continue their virtual or telehealth appointments, given, how we, to some degree, successfully managed some care by telehealth. And I'd like to ask Dr. McGillicuddy to comment on that a little bit, sort of what you're seeing, and any quick tools or tips to get people to engage in those appointments.
Well, I guess I'll just say two quick things. One is, if you take the term telehealth out and talk about engaging your patients with technology, I think probably your health systems, even the smaller ones, have a lot more tools available in their patient portal and those kind of things, and getting your patients trained up in digital literacy during a visit and ways to schedule their own appointments if they're available, making sure the reminders are there. And if your system isn't doing that, it does exist out there. So advocate internally to how to make things ever easier for your patients to get seen. I think from a true video visit perspective, I think the main thing to realize in the context of this conversation is, the two visits are not equal. There are in-person visits that have a lot of value. And there are uses for communicating with your patient and having a face-to-face video assessment with your patient and a talk. And from a patient's perspective as well with your provider, understanding that really what you're trying to do is fit into provide care and wellness in the context of that individual's life, the patient's life specifically. And just keep that in your core mindset rather than trying to supplant care. Try to reach out and try to enter the patient's life and see how you can help them within the context of how hard it is to get to the clinic or whatever it may be.
Thank you. I really appreciate all the panelists and all the questions from the participants. This has been very great. I'm happy to have had such an interactive session. And I'm actually going to start. I'm sorry we can't talk about everybody's comments and questions. So I'm going to start by adding something to this resource list and just let you know that I think from this, because we got your questions, even though we weren't able to talk about them all. From what we weren't able to address and what we did address, we'll put together a Q&A sheet for all of our participants today, and be sure that when we send some other materials out about a week from now, we include that so that you can see and have a copy yourself of what various people commented and suggestions and having the questions addressed. So we do have some resources we want to be sure you know about. Please don't check out of the webinar right yet, because we also have another poll that we want to be sure everybody gets to take before we sign off, and a post-webinar survey. Ms. Hughes, do you want to talk with us about your research about community-based organizations being a primary resource for providers and patients?
Yes, and I know when I was introduced, I'm the executive director for the Sickle Cell Disease Association of Illinois, and we're located in Chicago, but we are a member organization of the Sickle Cell Disease Association of America. And there are a number of states and communities with SCDAA, or Sickle Cell Disease Association of America chapters, which mean there may likely be one in or near your area. And you can definitely utilize the link here that's listed on the page to find out the chapter that's nearest to you and reach out to them for resources.
Great. Thank you. I want to tell you about some other resources that PCORI has funded us to develop as part of this project. First, there's a video of patients, caregivers, and providers talking about the challenges and the solutions to missed appointments. We created that last year, and we're updating it now, revising it with a little bit of information about COVID-19 and its impact on sickle cell disease appointments. We are creating a conversation guide for providers to use and for other healthcare professionals as well, and a facilitation guide for CBOs to use with patients and families in individual or small group settings, and also a patient and caregiver piece that they can use. It will be like an infographic that they can use to spur conversations and solutions with their providers, because maybe some patients may want to become a little bit more proactive themselves in starting those conversations. And last, we have the recorded webinar from our first webinar held in August of 2020. I also want to note that these tools that I've just talked about, or links to these tools, and the recording of this session, plus that new Q&A sheet, we will send out to all of you at the end, at some time next week after we've been able to gather the recording and get it up on our website. So let's end with a poll here. And that is, what will you do in the next week to increase appointment attendance? What's your takeaway from this meeting? Your most immediate one. Will you connect with a CBO, talk with a parent or a caregiver, think about patients' barriers and what that might mean for them. Make sure that you know what the clinic practices are for alerts and reminders. See them coming in I love that several of you are going to have a conversation and really spur these discussions directly with patients. I'm going to end the polling and sharing the results, and it looks like that actually having that conversation with a parent or a caregiver is coming up top. So I thank you for that, and also these other action steps that you'll want to do. I'd like to thank our panelists, and particularly to both our faculty, to Dr. NICHQ and Ms. Hughes, and to our guest panelists for bringing their expertise, Dr. Rowley and Dr. McGillicuddy. Thank you very much for joining us today. And I'd like to thank everyone for joining us, and also ask you to take 1 minute or less to complete this post-webinar survey. Again, you do not have to have taken the one at the beginning of the webinar or before the webinar in order to do the one at the end. They're 2 separate pieces. So I would really appreciate that and give you a little bit of time to do that. And I thank you, and I hope you have a good rest of your week.